Every year, it is estimated that over 3 million newborns around the world die within their first month of life. Up to half of these babies die on the first day that they're born. In Uganda, deaths during the first month of life or the newborn period remain high, with over 120 newborn deaths. This is in addition to about 100 babies who are born dead or stillborn each day. Most newborn deaths are caused by preventable or treatable conditions such as infections, not breathing at birth, and complications of being born too soon and too small. These medical causes of death come about as a result of underlying factors such as not being able to access care during pregnancy and childbirth. More than half of all women in Uganda still give birth at home without a skilled health worker present. Uganda requires a strong commitment to reducing newborn deaths if the country is to meet the 4th Millennium Development Goal to reduce the level of child deaths by 2/3 by 2015, which also links closely to the 5th Millennium Development Goal to reduce maternal deaths.
We have a 5-year strategic and investment plan. And among this plan and strategy, we have the maternal and newborn in our cluster, one of the 4 clusters that we want to implement. And in this strategy, we want to reduce the maternal and child mortality, maternal and infant mortality, and that of course includes the newborn.
These healthcare interventions include, for example, providing antenatal and postnatal care to mothers during and after delivery, and the prevention of mother-to-child transmission of HIV services are in line with those set by the World Health Organization, development partners, global and national experts for low-resource settings.
Usually, we support the Ministry of Health units, the various units related to this particular area of work, to ensure that there are policies addressing this and that the concept is mainstreamed in all the working documents of the Ministry of Health.
Through a multi-country program funded by the Bill and Melinda Gates Foundation called Saving Newborn Lives, Save the Children in Uganda has helped to catalyze national newborn health program planning and quality implementation.
The newborn health has come onto the national agenda by working with the different partners like UNICEF, academic institutions like Makerere University School of Public Health, professional bodies like the Association of Obstetricians and Gynecologists, the Association of Pediatricians. So through that, we have been able to lay an advocacy agenda with different partners and institutions.
The National Newborn Steering Committee, NSC, was set up as a platform to act as an advisory arm to the Ministry of Health on newborn health issues, ensuring that latest data and evidence is available for decision makers at each level of the health system.
This steering committee was set up, on the one hand, to provide advocacy, to bring the newborn program onto the agenda, not only the national agenda, but also on the agenda of development partners, on the agenda of implementers, on the agenda of health workers, so that they can all focus on the newborn babies. So that advocacy role is played again at all the various levels, with the policy makers, with the managers, with implementers, with partners, and of course also with the community leaders.
One of the most important platforms for getting women and newborns into the health system was through care during pregnancy.
It is important that a pregnant woman gets the necessary services, malaria prevention, preventing anemia, preventing other diseases, so that you guarantee the health of this child. So that's why the services should be integrated. But also there should be in existence the services to promote neonatal health, the newborn health, because newborn is a newborn. So there should be services to promote newborn health, but also services to promote maternal health, and this should be integrated.
While many women seek antenatal care in Uganda, healthy practices during this period, such as birth preparedness, were not always taken up. To achieve this, a number of factors had to be set in place. Most important of all was to equip health facilities, train more health workers, and the introduction of Village Health Teams (VHT) program. The VHT program is a community and family empowerment strategy designed by the Ministry of Health to focus on moving basic care closer to homes and increasing the capacity of communities to advocate, demand and take responsibility for their own health.
We are also doing training of the health workers so that they are able to identify the mothers that need help immediately. And we are also improving on the referral system so that when the mothers are identified for another level of care, the referral is in place and they are able to be attended to quickly.
The VHT program is complemented by community initiatives. For instance, in Mbarara, a district in western Uganda, a community-based organization called Healthy Child Uganda, locally known as Omwana Namagara Marungi, is looking at improving training and messaging to encourage healthy practices such as immunization, nutrition and disease prevention.
Healthy Child Uganda is a program that started in 2003, and it started after observing that so many children would come to main hospital here in Mbarara on their last legs. 30 children are admitted, and by morning almost half of them are dead. So the question was, what can we do in the community so that we prevent the preventable illnesses, and then at the same time, if children get sick, the parents know when to bring them to hospital so that they don't come at the last moment.
Our role as Health Child Uganda is to help in building capacity of the village health teams in the districts of Mbarara, Bushenyi and Rubirizi, so that they are able to train fellow village mates about child health in general.
Angela Tumwebaze is one of such community-based facilitators that are working with HCUG to train the VHTs in Mbarara and Bushenyi districts.
I trained them on how to do home visiting. They visit newborns, they visit mothers who are delivered, and especially those who have delivered within 28 days. They can check on danger signs of the children. That is, if the children have been born with the eye infection, skin infection, and other infections, whereby we tell them to refer those children to the nearby health unit.
Royce Karunji and Edwin Mugabe are a proud young couple living in Chitwerutoma village, Kajunju parish in Chabujimbi sub-county, Bushenyi district. 2 months ago, they were blessed with a set of twins that require much of their attention for their survival due to the fact that they were born small and the couple lived far from the health facility. They therefore needed extra support to cater for them. But with the presence of VHT members in their area, this young couple is lucky to receive professional guidance on how to look after their babies at absolutely no cost. The VHTs carry with them charts and other educational materials with pictures of babies that illustrate various danger signs that a mother should take note of. In case some of these danger signs are identified, say in babies or pregnant mothers, the VHT refers them to the nearest health facility for further care. 36-year-old Rose Gift is one such example. At about 6 months, pregnant with her 7th child, Rose developed severe abdominal pains. But due to the presence of a VHT member near her place, she was easily identified and immediately referred to this health center for treatment. While most women access the formal health system during pregnancy, quality of care and links between health facilities need to be improved to address the gap in service utilization during the time of childbirth and the early postnatal period when most maternal and newborn deaths occur. Coupled with this, most of these life-saving practices are not always followed by some mothers due to poverty, cultural beliefs and poor access to health care.
There are also other factors in addition to culture. Distance is one of them. The distance with the health facilities is you can't have a health facility offering maternity services in all the regions. So some mothers are far from those facilities. But also there's a component of transport. As much as it may be near or it may be far, if a person has transport, can reach the health services. But if the person does not have transport means, it becomes a bit difficult.
For this reason, the Ministry of Health has extended its collaboration with several local and international stakeholders to give special but cost-effective care to newborn babies and their mothers. One such stakeholder is Makerere University. Researchers at the School of Public Health are conducting a community-based trial called Uganda Newborn Study, UNEST, in Iganga and Mayuge districts in eastern Uganda. The study is designed to find possible ways of averting newborn deaths in the country.
We train health workers to improve the care for mothers and newborns. We realized from the formative research that most of the health workers didn't know how to resuscitate a baby, they know how to conduct a proper delivery, and the care for babies was bad. There were no drugs for newborn babies. So the health facilities and the health workers were prepared to receive babies such that when babies are referred, they receive better care or improved care, which we have been able to demonstrate in Iganga and Mayuge.
Iganga district is one of the more densely populated districts in the country with only one hospital which conducts on average 15 deliveries each day. However, several interventions have been put in place to improve the general health care of the hospital. Such interventions include, among others, training of midwives in proper handling of deliveries and emergencies during and after childbirth. Music, dance and drama is another tool being used to share information and ensure that maternal and newborn health programs reach as many communities as possible. Just like in Barara, this drama group in Mayuge has been instrumental in spreading information regarding newborn health to the communities in this district.
In village life, it's very hard to call someone and say, I'm going to educate you about malaria. They will not even understand what you're going to talk about. You will not even invite someone and say, hi, look here, our newborns are dying. But when you say you're going to watch a play, everybody will come thinking they are only going to watch a play. And of course, as they watch the play, they are learning.
Several cost-effective interventions such as skilled attendance during childbirth, immunization, clean cord care, as well as early and exclusive breastfeeding are being promoted to curb high newborn mortality rates. But key among these interventions is kangaroo mother care, a method used to provide relevant warmth to small babies who are born too early. Kangaroo mother care derives its name from the Australian animal which carries its baby called a joey in its pouch after birth while the joey completes development. It is believed that previously the care for small babies was lacking in most of these health facilities, yet it is one of the major factors contributing to the death of newborns. None of the Healthcare Centre 3s and 4s provided special services for the management of this category of babies. They were always referred to major hospitals. In cases where referrals were not possible, the babies would be covered with cotton and clothes for warmth, yet in some cases charcoal stoves as well as lanterns were used to provide heat for the babies.
When I just joined the special care unit in Mulago Hospital, we had these incubators. I think we had like 10 incubators. Once they started breaking down, it became very expensive to maintain them, and some were overheating, so we were running a risk of being accused. So when we started the kangaroo, actually we were losing many babies because all the babies who were born could not fit in those 10 incubators. We started a clinic on our ward, and we started with about 10 mothers, and 1 day a week. And we saw the clinic growing, and we started seeing 30 babies.
Masi Namusabi, a 3-year-old girl, is living proof of a child whose life has been saved through the use of kangaroo mother care. Her mother, Sumaya Namukuse, then 18 years old and a resident of Luida village in Mayuge district, gave birth prematurely and had no idea how to care for her small baby. Namukose and her grandmother, Robina Nabidie, had written off the tiny child, thinking it was already dead and destined for burial. But thanks to Margaret Tigawalana, one of the trained VHTs in the area, whose intervention at the last hour saved Namusabi's life when she was approached by Namusabi's grandmother.
Mukifuba ekya maama we kuba yalinga lowezi nga kali kumalayo myezi gye kale bwe namutaawo namusiba bulungi nga bwe kisaaniire n'ataawo obudakiika bwona nti buyinza okumumala namutoola okuba nga tikyetaagisibwa kabiri kumulekawo ino kuluwirira butimpegaano namusomesa okumubwika namusomesa okumunaaza okumulabirira omudondo ogwo obutaguleka obukyafu kubaawo namusomesa okumunsa.
In Iganga Hospital, there is another set of twins born prematurely at 8 months with a birth weight of 1.5 kilograms each. Using the skills they have acquired through trainings, the nurses are confident to guide these parents on how to practice kangaroo mother care to keep their small babies warm and well fed with breast milk. Birth asphyxia, a medical term that means the general failure to breathe, is a common condition in newborn babies, mainly due to obstructed labor. It constitutes about 26% of the common causes of death in newborns.
Before I went for that training, actually, at least I would get like babies die of asphyxia around, I would get a number of around 10, around 9. But nowadays, I get 1, if not 0.
Provision of health education to mothers during pregnancy and after delivery is also critical. During antenatal care, mothers are given health tips on nutrition, sanitation and hygiene, family planning, as well as HIV testing and counseling. Women are counseled on emergency planning as well as danger signs and when to seek care during pregnancy and after their baby is born.
Nga weetolooza wonna totya ko kajja kaaba naye gwe kola ki totya.
With such services available, even young mothers are encouraged to utilize them. For instance, at Luero Health Center 4, about 300 mothers are now able to attend antenatal care every week, and the health center now takes over 150 deliveries every month.
Because there is a committed team, they do their best, and because of the quality of work they provide, mothers have continuously used this facility without any break.
Essential knowledge and skills on newborn care have been strengthened. Educational materials have been developed as a contribution to national strategies, thanks to the Ministry of Health and other development partners. Through the different strategies, there is improved awareness on pregnancy-related complications, antenatal and postnatal care, as well as relationships between health workers and the community, among others.
In the Kisoga culture, how we have been behaving. As long as a baby has been born, the only thing which would delay if they didn't have a bath and water to bathe the baby. Immediately they would see this white coating on the baby. The baby is that and all that. So immediately they put the baby in the what? In the water. And they believe a baby should be bathed using cold water so that he can get accustomed to the environment. But this also has improved.
With the good policy environment in place, the newborn survival interventions can be scaled up, but dissemination of policies and ensuring best practices are followed remains a challenge.
We have not been able to work with the districts to prioritize. So that one should be part of our next agenda because they have so many demands. The other challenge is that we have so many partners. So we need to entice several partners to put newborn in their programming if we are to sustain newborn health.
Indeed, a lot more still needs to be done. For instance, there is need to have more field programming and newborn health champions in the various districts and local governments, as well as rolling out the interventions to cover the entire country.
I wish it was scaled to all the country. I know, of course, there are constraints in terms of resources, but it's a very good program. We have asked the Minister of Finance to give us funds, and in the recent budget you had it, Minister of Health had been given an increase in the funding, so that and most of this money is going to be targeted to personal recruiting, motivating and retaining the staff. We also have the World Bank project, which has dedicated money for maternal health. And this is also some of that money will be dedicated to purchase equipment, supplies, but also to make sure that we give skills to the health workers, make sure we recruit, retain, and motivate the health workers.
Directly, the money which is going to address maternal and neonatal issues is about 70 billion, which was put aside in our budget.
If the challenges described here are addressed, Uganda will be able to improve care for nearly 1.5 million babies who are born each year and address the deaths of 45,000 of its vulnerable citizens.
Uganda is moving very slowly towards its set target, but it is definitely moving. There are signs that maternal mortality is reducing. It's not static. There are signs that we are slowly getting more people delivering in health facilities. But what remains rather disappointing and stagnant is the number of children per woman, which has remained stagnant over the last 20 years or so.
Indeed, at 7 children per woman, Uganda has one of the highest fertility rates among the sub-Saharan African countries. The situation is further worsened by the shorter birth intervals of less than 2 years, which poses a greater risk of newborn death. Certainly, Uganda has got an opportunity to change this situation through improving quality of care and links between facilities in order to address the gap in service utilization around the time of childbirth and the early postnatal period when most maternal and newborn deaths occur.